Good morning. So right now I'm gonna perform a nasotracheal suctioning. So first is you have to check the patient's chart, obtain any pertinent information. So after that, we always make sure that we have to wash our hands when inside the patient's room. After washing our hands, so we're gonna hand dry it and then wear a clean gloves. And then also we also have to introduce ourselves inside the patient's room and what they're gonna do or its purpose. And we also have to check the patient's ID band to make sure that they're the correct patient. And also after we wear appropriate gloves and also introducing ourselves, we also make sure that we're gonna obtain a vital signs. We're gonna auscultate the patient. We're gonna check the SpO2, heart rate, the blood pressure, patient's color, and also how they were doing and their level of consciousness. So before applying PPE, we always have the gloves. We make sure that we're gonna set the appropriate flow, and then we're gonna put this one up to the patient with a non-rebreather mask in order for them to hyperoxygenate before doing the suctioning. So before putting this one up, make sure that the bag is fully inflated and then the valve is in place or there are no any missing parts on the device, and also there are no any misconnections. So once you're done, you're gonna put this on the patient. So leave it there until we're gonna start suctioning. So then after that, we always have to wear PPE, but before that, we're gonna turn the suction regulator on, and then we're gonna set the pressure about negative 120 to negative 150. And then we also have to make sure that these connections are not obstructed, no kinks present. And also with the suction bottle, we also make sure that there are no any misappropriate misconnections or any cracks also. So after that, we have to remove these clean gloves, and then we also have to make sure that we have the suction supplies ready. And then we have here the suction catheter, the lubricant jelly, and with the sterile gloves. So first is we're gonna wear sterile gloves. So after wearing sterile gloves, we're gonna pour appropriate amount of sterile water in the basin. And then we also have here the lubricant jelly. By the way, make sure that we're gonna put appropriate amount of lubricant jelly to the clean container in here or in a clean gauze. So after that, we have here, which is my non-dominant arm in the left side. So I'm gonna grab the suction catheter in my sterile hand, which is the right. Make sure that we're able to hear a hissing sound. That. And also we're gonna suck appropriate amount of sterile water first, lubricate it. Then after lubricating it, sterilizing it, we're gonna lubricate it with a lubricating jelly or in a clean gauze. So assuming we don't have a nasal trumpet in place, we can also do it without a nasal trumpet. So first is we have to make sure that we're gonna inspect the patient's nares, both of them, to ensure that there are no any obstructions or any deviated septum. So assuming when I observe this on the right side, there is any obstructions present, of course we're gonna do it on the other side. So because it's being lubricated, it will help and it will enable to insert with ease to the patient's nose. So just insert it gently. And then once you reach it in the first restriction, such as in the vocal cords, allow the patient to breathe in or cough in order for the vocal cords to open up. So after that, you're gonna push it down gently also, and then suck it up. And when you suck it, you should be able to do it less than 15 seconds. It should be not more than 15 seconds. When also doing the suctioning, you should not be able to do it in a circular motion, not to be too harsh to prevent any complications such as bleeding. And then once you're done doing the suctioning part, you should be able to remove it carefully and gently to prevent from the secretions from splashing in the patient's mouth especially. And then if you want to do it more than one time,